I was forgetting things, and that would have been 9-10 years ago when I first started noticing it, and I took an early retirement, age 62.
I would have to put things on the computer and send them to other people, and I started, some of my friends that were working there saying, "Do you know what you just said in the email?" "No." "Well, it's all gobble what you just put in there, huh?" So I thought, what the heck? So after, I thought, what's going on? So basically, I couldn't tell what I was writing.
I used to be one of the people who would give tours and take people around and show them the why and explain all the things, and I still could do a lot of that. But then there were parts where you would have to do follow-ups, talking to people and things like and that, and then it got more difficult.
Well, I knew I was having trouble with my memory, and so it didn't really affect me that much. Because I knew I had a problem. I knew my mom had Alzheimer's. She died of it.
I was diagnosed with early onset Alzheimer's.
It's a type of Alzheimer's, but it's posterior cortical. So a little bit different than what most people have if they have Alzheimer's of some sort.
We talked to the doctor, and the doctor was sitting there, and he asked me a couple of questions, and he made me, pick up my leg and that kind of stuff, and everything. I'm mobile, and that was all right. But he said to me, "Well, you're just going to have to get used to it because there's nothing you can do about that, and you're just going to continue to decline." That's what that doctor told me.
I'm very typical of folks who, especially professionals, who come to this particular place is because I've had a family member. Years ago, my grandmother was diagnosed with Alzheimer's.
My grandmother also had Alzheimer's disease and vascular dementia. There wasn't anything. There weren't day programs, there weren't supports for caregivers. The Alzheimer's Association was in its infancy.
We were a family that struggled. We weren't sure where to go to get help. And it was very difficult on the family.
So when we first started, it was a day program. It was meant for adults to be here all day. But we realized pretty quickly that we needed to respond to adults who were recently diagnosed, who wanted to come in maybe once a week for a few hours, learn about the kind of memory loss they were experiencing, and have different group arrangements for that.
Silver Club is comprised of 4 or 5 different groups. So there's Coffee House, then there's Elderberry Club, there's Wisdom Keepers, and Wisdom Keepers is sort of our transition group. Many of those folks who are in Wisdom Keepers also spend a day or part of a day in the adult day program.
We're really fortunate here, not just the community, but the university health system and campus. We get to bring in all sorts of speakers from the labs. So it's not unusual in Coffee House to have someone come in from a molecular cellular biology department, someone from neuropsych, someone from social work, someone from neurology.
We do creativity things, we do field trips out in the community, we do a lot of discussion, we do education. So I guess it's a variety, a spectrum of things that we do.
They're great. For one, it's nice to find that somebody else has the same, I don't want to say disease, but whatever it is that we have. For one, to know that you're not the only one that has a problem. And being there, everybody is there to share their information if they know some things that would help you. But they're not only just that, though, it's like a family.
If a doctor tells them they have no chance of getting better, that they should get up and leave that doctor walk out of the room.
It's comforting to see other people who have the same problem you do, who are still functioning, and some of them have had it a lot longer time than you have. Some haven't had it as long as you, but you're still a group of people who are living well with Alzheimer's disease or some other dementia.